Hello, everyone. It's Dr. Jensen from Dean's Chat. If you're on the fence as to whether you want to join the American Podiatric Medical Association, jump on in. It's a new APMA. Whether it's advocacy concerns, scope of practice, billing and coding, consider membership at the APMA as your professional insurance.
Hello, everyone, and welcome back to Dean's Chat. My name is Johanna Richey. I'm the assistant professor at Midwestern University and the co-host of the Dean's Chat podcast. Today, I'm actually joined by my guest host, Dr. Tim Miller. Dr. Miller practices currently in Florida. I'm very excited to have him here because he is an alumni of the school for which we are interviewing today. So thank you so much, Dr. Miller, for joining me.
Absolute pleasure, Dr. Richey. Thank you for having me.
Yeah, and normally, you've been a guest on this show. We usually go first names, but when we do have students on, we do maintain our professional decorum. So we will stick with Dr. Miller for the rest of the interview. I will slip up because I'm human and it happens, but we'll try to stick with some of the professional decorum. But I'd love to just have a quick word from you. And what was one of your favorite parts about being a student at the New York College of Podiatric Medicine?
So I thoroughly enjoyed my time at NYCPM. Now, I'm from New York originally. I'm a Queens kid, and I was born in Queens and then moved out to Long Island. But having that unique atmosphere of New York City, living in downtown Manhattan, having everything at your fingertips and not just the food. Obviously, I gained some weight when I was in school because of that, but it was more of the pathologies that we were able to see in the clinic. It offered such unique insight because our clinics, we would have multiple different backgrounds come in, and it was pathologies that I only read about in textbooks actually coming in and be able to have that firsthand experience really has set me up through residency, through fellowship, and through my practice now. So that was my favorite experience at NYCPM.
Oh, I love that. And not to take the whole interview, because as you guys know, I could sit here and probably talk to Dr. Miller just by myself we did in an airport for about 3 hours. So I don't want to mistake our time because I could talk to each one of you for also 3 hours. So I'd love to we'll switch into the intros for our guests today. So today we have the American Podiatric Medical Student Association representation from the New York College of Podiatric Medicine. I'd like to welcome student Dr. Nguyen, class of 2027. Welcome to Dean's Chat.
Thank you. I'm really excited to be here.
And we have student Dr. Disal Wickramasinghe, class of 2028, here representing for the New York College of Podiatric Medicine. Welcome.
Thank you so much. I actually ran into Dr. Richey a couple times now in conferences, so I'm very thrilled to be here on the podcast.
And it's so funny because it's that moment where I'm like, I know I've met you. In fact, I think I stood next to you for a long period of time, maybe at a poster thing.
Yeah.
At one of the conferences. All of a sudden I'm like, yeah. I have talked your ear off already. All right. Well, welcome, Disal, to the official podcast. And Derrek Wilder, welcome to the podcast, class of 2026.
Thank you. Glad to be here.
Yeah, getting ready to graduate. Derrek, how's it feel?
It's amazing. It's a long time coming. So very excited. Job's not done, but milestones.
Yeah, absolutely. Fourth year is when it really all kind of comes together, right? So we'll go through the course of the interview, kind of asking each of you some questions. We really want to hear from you. The students that are listening and prospective students, they want to hear really from you. So we would love to start with, if each of you can talk about where you went to undergrad, what you got your degree in, and then how did you find out about podiatry? So Megan, we'll start with you.
Okay, so I went to undergrad at University of Miami, and I was a major in public health. And how I got into podiatry was after doing a master's also at University of Miami, I was a medical assistant for a vascular surgery private practice. And I was doing a lot of wound care there and doing a lot of wrapping like on a weekly basis. But a podiatry resident was actually rotating through. And I was kind of discussing sort of where I was applying to and how I wasn't really sure of my path. And he asked me if I ever looked into podiatry because, if I can handle wounds, like that's something that I should probably look into. And that's what kind of started my deep dive into researching into podiatry. And I went to a Women's in Podiatry webinar, actually, that was given by NYCPM. And so hearing a lot of the female perspective of what a podiatrist is, the work-life balance, that kind of really drew me into sending in my application.
Oh, I love that. And, it's so funny, right? The little stepping stones that land in our path that help, sometimes not even a full pivot, but just like just a little adjustment, and hearing your experience in vascular surgery and then how that impacted, oh, wait, I can still do some of these things that I find interesting, but also there's a whole nother specialty to include all of this. And I love that. Disal, how about you? Where did you go to undergrad? What was your degree? And then how did you find out about podiatry?
Yeah, so my story was a little bit different because I am from Canada. So I did my undergrad in radiation therapy here at Laurentian University, my hometown. And then I followed up with the master's in interdisciplinary health. I knew I wanted to be in healthcare, and it kind of turned out to be an accident where I had like a sports injury, and there was actually one doctor of podiatric medicine in Sudbury, where I'm currently residing. And so he actually went to Kent State, studied there, and then came back to Canada and opened up his own practice. So that's where I stumbled upon the world of podiatry, and I shadowed him, absolutely loved it. The work-life balance, as Dr. Miller was saying, the diversity of patients that you see, the different pathologies. And coming to New York and shadowing some doctors in New York kind of solidified it for me. So it was really an accident, but I'm very glad I discovered it.
Oh, absolutely. And shadowing is such an impactful opportunity to really truly see what is offered in the world of podiatry. And I've heard two things now, Dr. Miller, that are common themes, and that's mentorship. So we'll touch on that, I'm sure, in a little bit. But Derrek, how about you? Where did you go to undergrad, and what did you get your degree in? And then how did you find out about podiatry?
So I attended the Pennsylvania State University undergrad for biology, and I got into podiatry via I used to work in a podiatry office after school in high school. I would come in after school and take socks and shoes off of patients for a few hours, and that's how I learned about podiatry initially. And eventually became an MA there full time, and went back and forth during undergrad to work and shadow with my mentor at a limb salvage practice in my hometown. It's pretty close to my house, and that's really how I got to see what the profession and what we do as podiatrists.
Oh, I love that. And certainly working in the field gives you a whole different perspective on the day to day. As a student, has it been fun to see some of the things that you had seen in your working experience, but with a different lens and perspective?
Oh, yes, absolutely. Kind of like, seeing the sausage get made, I saw the light at the end of the tunnel. I knew exactly kind of what my life would be like after school. So I always had an open mind sitting in classes. And as far as clinic goes, I relied heavily on my prior experiences as a medical assistant. So it was good. It's, seeing what goes into making an orthotic, or what goes into decision making when treating wounds. Just seeing all the knowledge base that goes into treating patients versus just working alongside the doctor as a medical assistant has really been an eye opener during school.
Yeah, that's fantastic. Dr. Miller, your thoughts?
Yeah, the things that jump out to me during these conversations with podiatry students is the varying backgrounds, right? It's such a melting pot of different experiences, different living situations, and it all comes together. And after speaking with podiatry students from all over the country, that's a very common theme, is that all of the backgrounds are uncommon.
Yeah.
And I love that, because in other paths, there's a lot more traditional ways to going into that. And I think that's what makes podiatry strong, is the fact that there are so many different perspectives that when you are collaborating on a patient or a pathology, you may not know. Like Derrek, you had talked about experiences that you had as an MA. Same thing with you, Megan, that you may have remembered that one experience you have had, and then that translates into patient care. So you're positively impacting those patients immediately based off those varying backgrounds. And I just absolutely love that. So it's great to hear your different backgrounds and how you approach podiatry now and how you can see that light at the end of the tunnel and the future is bright. I'm so excited for all of you guys. Now, one of the things that I would love to get to know is, so when I was in NYCPM, APMSA was really important. It was important just as a student group, experiences amongst each other, and as a whole in the community. So I'm going to start with you, Derrek. What's your role in APMSA, and how has that impacted your view at NYCPM?
Right. So in APMSA, we are elected by our peers, the student body, to represent our class in APMSA. So at our school, we have a primary and an alternate, but we're exactly the same. My alternate tube was great, and I wouldn't be able to do, half the stuff we do without, leading on each other. But what we do is we are advocates for the students. So when we take our board exams, or if there's anything that affects the education of podiatry students, at our House of Delegates meeting, we go and we discuss changes that are happening to the profession as well as educationally for the students, and then we report back to our student body, the updates and the different things that are happening within education and the profession. And we also get feedback from our students and take that with us whenever we go to our meetings and say, hey, we students in the Northeast region or in New York are experiencing this and, having, these kind of issues. So kind of talk about everything encompassing students in our school and in our region. I know in the Northeast, it's us and Temple and recently LECOM. So the delegates from those schools will, compile all the things that are happening for students and kind of discuss those at our House of Delegates and see if we can come up with solutions or at least resolutions to get the ball rolling for initiatives that can, later on maybe change some things or at least, get the discussion going.
I love that you bring up the House of Delegates as well, too. Being as a student at the House of Delegates and now from a practitioner House of Delegates, seeing both sides and how intricately it works in the student life and in what we govern as a podiatry as a whole. So I love that you have that perspective. And one of the things I would love to impart on you is hold on to that, because that will carry you through. Those connections that you make and what you learn will carry you through how you're going to work as a group during residency and fellowship and even practice and beyond. So I love that for you that you have that. Megan, I'd love to hear your role at APMSA in NYCPM.
Okay, so I'm currently the Student Government Association president. So when I was elected at the end of my sophomore year, I basically am only a member of the House of Delegates for my interim time as SGA president compared to Derrek and Disal, who are kind of elected into this position. That's a 4-year-long position. So mine's technically a 2-year position, but I bring kind of the perspective of the student body because I work really hand in hand in like the curriculum meeting, for example, at the school. So every month, basically, I just came from one today, actually, but I'm involved as a student body representative within the curriculum meetings with our admin, so within kind of a school level. So I get to bring that perspective to the HOD meetings as well. So
cool. Just again, the different backgrounds. I love that you get to bring that in there too. And Disal, you're up. Let me hear it.
Well, like Derrek highlighted, it's a very big responsibility and a big honor to be selected and to represent your class and, to bring and voice concerns that students may be having. For example, like the past, like how boards was conducted, like board exams was conducted, and what can we do to improve it so students have a better opportunity when they go to write the board exams. Also within APMSA, we have the opportunity to be part of subcommittees. So, for example, I'm part of the political advisory committee within APMSA, and our goal is to help advocate for podiatry. And just recently, we actually hosted an advocacy day at NYCPM with other organizations like APMA, NYCPM, and we had a multitude of guest speakers to kind of showcase to the students what we have achieved thus far. And recently, we're just waiting for the governor to sign the bill. But in New York, podiatrists may be able to practice up to like the tibial tuberosity, which is a really big win for podiatrists in New York. And it took about 10 years of work. So it's important for students to know that this is going on behind the scenes, and it's up to them to take it on after and continue advocating for the profession forward. So APMSA provides a lot of good opportunities, and I highly encourage students to get involved with these organizations.
And I love that. And this, I'll let you in on a secret. It's been a lot more than 10 years.
Right.
So, yeah, but the fact that now that headway is being made, not only, but it's really full steam. And the support that you have through NYCPM and APMA, and how you three work together to promote and push podiatry forward is fantastic. And I'm glad that you can offer that to the students at NYCPM. Thank you.
Thank you.
Yeah. And, it's so fun to hear too from students, Tim, their enthusiasm and their passion. And each one of you brings something unique to the table that no one else can do except you. So as Dr. Miller had said, carry that with you into practice, into the rest of your career, and find the things that you do well and lean into that and share it with the world, right? I was texting a student today, and I was kind of tongue in cheek, but it was a gratitude email, and I was just sending something back, and this cute little catchphrase that I'm gonna plant here so that it can take off is, let kindness and gratitude be the thing, or no, kindness and excellence be the next pandemic. They're contagious, so help spread them along. So as you continue in your future, keep spreading your version of excellence that only you can bring. And on that note, I'd love to pivot to my next question for you. It's always nice to be in the position. Derrek, you're about to graduate. I mean, I say that also. I know it's still technically October, but you're very close in the spectrum of looking back. Like you've made so much progress. What are some things that you wish you would have known prior to starting school, or something maybe that surprised you about podiatric medical school? We'll start with Derrek this time, and then we'll go. You may have already started with Derrek, Dr. Miller, but because he's got the most wisdom, we're going to let him go first again.
Yes. So, with the background in private practice podiatry, limb salvage to be specific, I knew kind of like some private practice stuff before coming to school. But I guess one of the things that surprised me, even though my mentor told me that the schools are like this, is we really get a very holistic view of medicine in our school. Our school tries its best to follow a pretty strict allopathic curriculum as far as teaching us the whole body. Before we get to our third year, we focus primarily on podiatric medicine. So I was really just surprised that the depth and that we get into as in our education, as at least at the New York school, for before we even start to focus on the feet. So that was probably my biggest surprise. But I mean, I was prepared for it. I knew it was going to be difficult. We have a really good reputation for academics at our school, so I'm very thankful for it. But that was the biggest surprise when I got to school.
Any advice you would have given your younger self in prepping or studying for those more holistic versions of what you expected?
Yeah, I had very little. I had very little exposure to. I had very little exposure to like pharmacology type stuff, and so I would say familiarize yourselves with some of those prefixes and suffixes. It will help in the future.
Yeah, that's great advice. All right, Disal, you're going to be next. So tell us something you either wish you would have known or surprised you, or kind of both. And then I like the advice question because, we'll take little snippets of this, and that's really what the students like to consume, are small snippets of information. So impart on us your pearls of wisdom.
Yeah, as opposed to Derrek, I'm relatively new, but one thing that surprised me was how big podiatry is in terms of what you can do. Coming into podiatry, I thought, you can be a foot and ankle surgeon, you can do surgery, But then you come in here and you understand you could do sports medicine, you could do limb salvage, you can do wound care. Like there's also like, even though we are a specialty, there's like subspecialties within these specialties. So that really opened up my eyes. And I'm really excited because it gives me new opportunities or paths to pursue and trying to keep a holistic view about my future. In terms of advice, I thought I could, get through med school alone. And I quickly realized you cannot do that. So one thing I really loved about NYCPM is how much you can lean on peers like Megan and Derrek. You can ask them for resources and they will hand it down. And the whole culture at NYCPM is really positive. And I would highly encourage students to try not to take it all upon yourself and lean on others. If you have resources, share it with them and they will do so in kind as well. So it's a marathon, not a sprint. So try to treat it as such, and support each other as you make it through this journey.
Oh man, Disal, you have wisdom beyond your years, my friend. That is such good advice in so many capacities of human life. We are social creatures and we thrive when we support each other and have that support given back to us. So that is really excellent advice. All right,
Richey,
Megan, go ahead. Yeah.
I'm so sorry, but I just have to comment on Disal. That goes along with what you were talking about, Dr. Richey, before about the kindness and excellence, right? Make that the next pandemic. Obviously, Disal is talking about the kindness and excellence that students above him are passing down to him. So, and that was my experience at CPM, that, it was very congealed in a way that we were all together. We felt like we were a unit as opposed to separate entities. So I love that experience is still going on for you three.
Very much the culture there at NYCPM. The seniors that were there when I got there, I'm a January student, so the seniors that were there when I got there, helped me as long as they was there before they graduate. And then, throughout the years, I always, lean on the upperclassmen. Even now, as they're interns in their first year of residency, I still bug them and ask them stuff as I'm about to be approaching that as well. So it's a very strong culture of camaraderie and really almost like a, kind of like a family, but it's a little different. But, we're all there to do the same things. We're all, trying to make it. So we all, try to help each other at NYCPM.
All right, Megan, how about you? What were some of the things that surprised you or things you wish you would have known prior to starting? And what advice would you give your younger version of yourself?
I kind of did have a similar experience to Disal, where I really did also find a lot of mentorship in a lot of my upperclassmen. And I didn't realize how much of a tight-knit community podiatry was in terms of not even just upperclassmen, but within just seeing our faculty. A lot of them went to school together and just seeing how everyone is, really friends, and it is truly like a family. And all these opportunities to make these connections are out there. You just have to get out of your comfort zone to just say hi sometimes and ask questions. Don't be afraid to speak up and ask for help, because it can go a long way when you start forming these relationships and just putting yourself out there. You don't have to go through it alone. We've all gone through this similar path and journey, and it's a tough journey, but when you have people to lean on, it makes it a lot better. And yeah, that's pretty much it.
I love that. And you had reflected earlier in the interview, even that, representation matters. Being able to see a women in medicine seminar helped spark your interest in a particular, in the New York school specifically. And these are the things that, exactly to your point, Megan, just being willing to kind of reach out and say, hi, like, I thought this was great. Actually, even in the pre-show, which the audience doesn't get to see, but we had two different experiences with the panel here. It is a small world. It's a small profession. And making that initiative of going out and reaching and saying hello or introducing yourself feels scary in the moment, but I don't think anyone would ever be rude or blow you off. It's just not, we're the happiest profession in the hospital. Like it's just not the vibe. So I can absolutely mirror that, Megan. All right, Dr. Miller, back to you.
All right. So now that I've been out, and I graduated NYCPM in 2015. So we're looking at, I'm 10 years out. I still get excited every day, no matter what I'm doing, whether it's clinic, whether it's patients, whether it's hospital rounds. I get excited because I know that I can help people, right? At the end of the day, that's why we're here. So as students, I want to hear what gets you the most excited throughout your day. And Disal, you have not been the first yet, so it's on you, buddy. Let's go.
For me, like you touched on, Dr. Miller, I think of it as like, at the end of the day, this is a patient's life that you have on your hands. And coming from radiation therapy, you know, working in a cancer center, you see cancer patients going through radiation therapy treatment, chemotherapy treatment, and you understand how much trust they put in you. And it's the same in podiatry, you know, whether it's just like removing a callus or like a big surgery, they're putting their trust in you. And at the end of the day, you should be putting your best foot forward to ensure that they have the best patient-centered care. And, you know, I may not ace every exam or anything like that, but I try to learn as much knowledge as I can so I can help my patients in a safe and holistic manner. So that's what keeps me going.
Awesome. I love that. And listen, it's not about acing every exam, right? It's about getting as much knowledge as possible because you're helping your future patients now by what you're learning. And I love that you have that insight because it took me a really long time to get that, right? I went from undergraduate to NYCPM and I was in the mindset of, oh, study for the test, right? And then it hit me that I was really studying for my future patients. And I love that you have that now. So Megan, what are you most excited about?
So I'm a third year right now. So I'm just now finishing up my first rotation, my surgery rotation. But one of my favorite things is now that I'm starting to be in the clinic, it's putting the pieces together finally in practice and seeing the stuff that I'm learning in my lectures finally in person. For example, we learned about the log-Hansen classification and then seeing that on X-ray and actually getting to talk to an attending and saying and classifying a fracture and discussing with it and actually applying my knowledge in a clinical setting has been really exciting. Or even seeing a patient who is on like amlodipine and seeing the actual swelling in her feet and asking when it started. And then, oh, it began when this medication was prescribed and she started taking this. So that's, you know, it all comes together and it fits into a little piece. And then you start realizing that you know a lot more than you did when you first walked into the school. So I think that's like the most exciting thing.
That it's actually working, right?
Right.
The hard work that you put in, all the countless hours, maybe some sleepless nights, but it's coming back and it comes back and it makes you want to keep going. I love that. So Derrek, what about you?
So I'm a fourth year out on externships. I'm currently at a level 1 trauma center right now this month. And the one thing, well, it's kind of two things, goes hand in hand. I want to know what big cases are going for the day. So, you know, biggest cases, you know, most interesting stuff that really gets me excited. I just, you know, I love seeing what, you know, the large variety of what podiatrists can do, because it's definitely, you know, expanded and has, you know, progressed a lot over the last, you know, 15, 20, 30 years. So big cases, you know, that really excites me, as well as patient management, really. Being able to follow a patient that we did surgery on and then to see them in clinic, at least for, you know, the first, I think 2 post-ops would be ambitious because we're only here for a month, but, you know, at least for the first post-op and seeing how they're doing, you know, following surgery and, you know, getting those first post-op x-rays, seeing how everything's holding is always very exciting for me.
Cool. Cool. And you bring something up because when I have students rotate through and I talk to them, they like the big cases get them excited. But one of the things I want to impart on all three is that everything is exciting, right? So when you're doing surgery on a patient, maybe something as routine or simple to us as a toe amputation is life-altering to the patient, right? That's now on their medical record. When you go past surgical history, boom, it's on there. And that's something that becomes a part of them that other doctors may ask. So what I would recommend, obviously, those big cases are great, but even those other cases that seem a little more routine, try to learn something from that. Like try to get excited about something, maybe a different technique that the attending is doing, or something that the resident is prepping you on for the case, talking about the history of the patient. So view everything like that. And that has helped me in my practice now, because I carried that throughout, because that resident actually told me when I was on externship, because I had a very similar mindset, but that was what was told to me and has changed my perspective forever.
Absolutely. That's why I said it was twofold. I like the follow-up, the management part too. I like, seeing the post-op as well.
Cool.
And this is such a fun, like, reflective opportunity. We're going to take a quick moment to hear a word from our sponsors. But while we do that, the next question is going to be about professor shout-outs. So you can start thinking about your clinical professor and a didactic or basic science faculty. So, but let's switch to a shout-out from a word from our sponsors.
Did you know APMA provides help with public health initiatives such as fall prevention, opioid abuse prevention, and addressing health disparities?
Did you know the APMA provides over $400,000 in scholarships annually to students pursuing podiatric medicine, helping the next generation of foot and ankle specialists?
If you're serious about this profession, if you want to grow, to lead, to make a lasting impact, join APMA today.
All right, we're back. So Megan, we're going to start back with you. So for professor shout-outs, we had talked earlier about gratitude. Tell me, if you were to pick, and I know it's hard sometimes to pick just one, but I'm sure you won't all pick the same one, so we can spread the love around a little bit. By a basic science faculty and a clinical faculty, who would you shout out?
My favorite preclinical faculty is Dr. Sushma Rich. She's one of our adjunct professors, but she taught us lower extremity anatomy. I think she started teaching it. I don't know. I don't think she was there for you, Dr. Miller, when you were there, but
No.
she was really, really great. And honestly, I loved how much passion that she had about it and just how much energy she gave when she was teaching a very difficult subject, but she would often yell at us, but in the best way possible. And it really stuck in my brain. And I still remember her yelling at us like to this day, but it, whatever works, and it worked. So. And then my favorite clinical professor is Dr. Rice, Dr. Susan Rice. I think one thing I really, really love about her is how much she cares about her patients, and it's so evident. And one of her main goals that she tries to instill in us is to make these connections with your patients and how important it is to treat a patient as a whole. They come into your office and they have a whole story about them. And it's important to ask not just about their feet, but just about their life and what brought them here into your office. And I really respect how much she emphasizes that. And I respect her because she will remember a patient. I don't even know how she can remember it, but it really impresses me. And I really love that about her.
Oh, I love that. So much of good medicine can be mentored. And when you hear someone phrase something in one way, or the way they approach a patient, the empathy, the passion, the contagiousness of it, you're absolutely right. When you see those things, start to embrace them. And you can also learn from things that you're like, oh, I just learned something that I don't want to do. And as Dr. Miller said, you can learn from every single experience that you go through, but definitely collect all the really good ones and start putting them into your mental models for what you will do when you get out and start handling patients on your own. All right, Derrek, tell us a little bit about professor shoutouts, a clinical and a basic science faculty.
Yeah, I'm upset that Megan took two of my more well-liked, professors. I will say Dr. Rich doesn't yell. She speaks loudly.
Yes.
Speaks loudly.
Well, passion can come out in a lot of ways. So,
for preclinical, I would have to say Dr. Battaglia, because before I got to school, I thought I knew about, nerves and how they worked, but clearly I was ignorant until I took his class and learned so much more. So he really helped with my understanding of the nerves and neurology, and it's really helped me going forward in podiatry school. So Dr. Battaglia, our neurology professor. And then for clinical, I would have to say it's Dr. Samuel Adebayega. He gives so much time to us students, and he works so hard for us and gives us a lot of his time. I don't think the man ever sleeps. And, he's just really really a good advocate for the profession and as well for us students. Like anything you need, he'll, try his best for you. And he really just wants us to succeed and be excellent doctors. So Dr. Samuel Adebayega and Dr. Battaglia are my professor shout outs.
Oh, I love that. All right, Disal, not to give you the hard job of going last, especially with the least amount of clinical experience thus far, but find something in there.
Yeah, I was gonna say I might just only have preclinical professors because I haven't been exposed to the clinical courses that much yet. But I would
You
like
can
to...
take 2 on basic science if you'd like. Then that's fair.
Okay, perfect. Yeah. I would like to give a shout out to Dr. Basu. She teaches infectious disease and microbiology at our school. Not only is that like a very important subject for podiatry boards and all of that, but she runs actually a very large section of the research department here at NYCPM. And so she's always willing to, take students under her belt to advocate for podiatry in a research way so we can come up with the best possible ways of putting podiatry on the map. And that's actually where I ran into you at the APMA conference at the student poster presentation, was because of her research mentorship. So I really appreciate that about her. And as Megan said, Dr. Rich is wonderful, teaching us lower extremity anatomy. But if I could give a shout out, would be to our immunology professors, Dr. Mafucci and I'm forgetting the name.
Jones.
Dr. Jones, there we go. Dr. Mafucci and Dr. Jones, they're lecturers from Torrey University. Since we have recently joined Torrey University at NYCPM, but coming into immunology, I was very concerned because I have never taken a course of immunology before. I did not know anything, but they teach you at the very basic level, like you know nothing, and then they build you up. And it was really refreshing to sit in the lectures and at the end of the semester know about all these important definitions and concepts that will stick with me for the rest of my podiatric career. So I'm very appreciative of the professors and all the faculty here at NYCPM.
That's lovely. And yep, it's as soon as you hang up on this call, you'll start to think of so many other people that you're like, oh, I would have said this person, that person. So it's okay. I think everyone understands that, there's a little pressure on the spot too, but all right, Tim.
If you don't mind, I'm going to give some shout outs too.
Oh, yeah, definitely.
So
some oldies and some classics along with some new favorites. I love it. Let's do it.
I definitely agree with Dr. Susan Rice, and I encourage all of you to go and see her and tell her that you talked with me, because I hope I am still one of her favorites. So her and I have texted over the years since I left. Also, Dr. Russell Volpe, who pediatrics, and him and I have texted recently as well too. So even after 10 years, I still stay in touch with some of the professors there. Dr. Kevin Jules, is Dr. Jules still? So Dr. Jules is
still there. Yeah.
Boy, I always thought I was smart until I talked to Jules, and then he just knew so much more than anybody I had ever met in my life, and I realized I knew nothing. And that
what did he teach?
He was surgery. He was podiatric medicine and surgery. He did more of the intro surge. He was Pod Surge 1, and then Pod Surge 2 was somebody else. I don't know if that's what he still does there. So. And then preclinical, I actually had Dr. Battaglia as well too, so I thought he was great. Fortunato, that was his first name. He's a phenomenal guy. And then the rest, I don't think are there anymore. We had Dr. Peter Barbosa for biochemistry. We had Dr. Daria Dickey. was our lower extremity anatomy, and she was phenomenal as well. But overall, one of the things that I really enjoyed, and I came from Johns Hopkins. My undergraduate was Johns Hopkins, so a huge research, huge medicine facility. And then coming to NYCPM, and it was just the magnitude of the lectures and the intelligence of the lecturers, but like you have echoed, the ability to relay the information in a way that people could understand. And that really is the basis of podiatry, right? Podiatry is hard, medicine is hard, but we're all in this together, and let's teach you so you can be a person who advocates for patient care in the future. And that was the main thing that I love, one of the main things I loved about NYCPM. So I'm going to go on. I get to go on next, right? It's my turn. Nice.
That's right. But it's a beautiful segue about inspiration. So.
Oh, yes, it is. See, maybe. So, okay. So I'm going to start with Megan on this one. So Megan, during your time at NYCPM, and it could even be your pre-podiatry days that led you into podiatry, give me one experience that you went through that truly inspired you to become a physician and to continue your path the way you're doing it now.
Oh, okay. That's a deep-seated question. Okay.
It's getting deep. Here we go.
So one experience before or during that makes me want to continue. You might have to cut this because I'm still thinking.
It's all right. You're allowed to be reflective.
Yeah. So if you want, how about this? I'll start.
Okay.
I'll start and I'll give you away from what happened to me. And Dr. Keith Springer, I don't know if you know who Dr. Keith Springer is, may he rest in peace. He passed while I was at school, but he was one of my professors. And during our medicine rotation, he had to talk with a patient about an amputation, right? And it was more about a below the knee amputation, right? We know that is a life altering and mortality, morbidity significantly increase. And up until that point, I was so in the books about things that this was my first rotation in my third year. And the way that he talked with this patient was something I would expect like a mother talking to a child. And I don't mean to equate that to relationship, but the compassion that he had, the ability to relay that this is something that we need to do to help your life, help you get back to things that you need to do. And he had spent, it must have been at least 45 minutes with this patient and just talking with the patient like the patient was a human being. And I cried. The other students in the room cried. Like the patient was crying, Dr. Springer was crying. We were just all crying, but it was all for the benefit of the patient. And that just put a light bulb in my head. And that's when I said, hey, this is the profession that is meant to change the world. And I want to be a part of that change. So that's what inspired me. Not to go too deep because I'm going to start crying if we start talking more about it. But Megan, if that inspired you, go ahead. If there's something that you want to hold off on, I can move on.
It did. I think one of my earlier experiences working in the clinic during my third year, there was a patient who had a non-healing ulcer after also having an amputation, but we had to do a bone biopsy in the office. And obviously it's a very traumatic experience for a patient. But even though I wasn't doing that much hands-on, I held her hand and was there for her. And she gave me a hug afterwards, even though she was admitted to the ED, and I was there waiting with her and just sitting and talking to that patient. And I think you can realize how much of a difference you can make in a patient's life, no matter how much level of hands-on activity that you're doing with them, even just sitting there and talking to them and just waiting with them, even though waiting for them to call their parents and to come into the office, it can make a big difference. So it makes me excited to be able to do more and also understand that I still play a valuable role as a student.
That's great. I love that response. And you do play a valuable role. The second you have that patient, the patient's looking at you, you're wearing that white coat, you're automatically in that role. So, Derrek, I see you shaking your head. Let's go. Well, what about you? What experience has inspired you?
So this was before I actually came to podiatry school, before I even got accepted. This was one of my last days at the podiatry clinic I'd started at with my mentor. Started medical assisting at the one that I'd take socks and shoes off at in Raleigh. It was one of my last days there. There was a patient. He, uncontrolled diabetic. He had some non-healing ulcers in his forefoot and osteomyelitis in the forefoot and midfoot. He had seen other doctors and they said that he needed a BKA, but we were able to do a distal amputation and get him closed and healed, get him a prosthesis for his shoe. So he was following up. This was like his first follow-up with the toe filler in his diabetic shoes. Everything was good. Everything was clean. Everything was nice. I told him I was leaving. This was like my last week at the office because I was moving to Tampa at the time. And he said, okay, you guys really helped me. And this was awesome. I'm really glad I found you guys. And he said, I have a card. And I went to go give it. I went to go get my mentor so he could give him the card. He said, no, this is for you. So when I took it home and I read it, he really said that, he knows that, Doc, my mentor did a lot, did the surgery and everything, but he really noticed, that I had, good compassion. I was, worked really hard for him, anything he needed. And he said that, I should, pursue this and continue this. And that really stuck with me, that a patient, wrote a card for me, the medical assistant. So it was really, eye-opening for me that, I have an affinity for this, and this is something I want to do for the rest of my life.
Awesome. I love that. No matter what role you play, you mean something to the patient. Okay. Disal.
This is very emotional. I would say my inspiration came from a volunteer event. So every year we have this event called the Don't Walk By event. And basically where we go to downtown New York and provide basic services like a foot bath to people that might not have access to a podiatrist or other healthcare professionals. And I got to see patients that, that have various feet-related problems. And I was just simply giving like a foot bath, with just no medical intervention, nothing like that, giving them a new pair of socks. But then just hearing them say thank you and being, for them to walk a little bit more comfortable back home just made my evening and kind of just inspired me, because we take it for granted, being able to walk. And some of these patients, they've never seen a podiatrist before, and they have all these sorts of, foot-related issues. And it really inspired me, like, to do my very best and to put my very best foot forward every single day to help these patients, because I do, we do take these small things for granted, but for them, it is a very big deal. And so it was a very, very emotional, but a very touching volunteering event that truly inspired me.
I love that. And I love going back to what we had talked before. It's a melting pot. Everybody has their experience and it's all different. And then when we come together, we can use that experiences to promote patient care and to make ourselves, really integral in the patient's lifestyle and helping them get back to what they want to do. So I love all those stories. What about you, Dr. Richey?
Oh, 100%. It's always fun to hear exactly as you reflected right there, Disal. They don't have to be these big, monumentous, I saved this guy's life, right? Like, they can be small things. Each one of you commented on actually something in the spectrum is kind of a small act that made a huge impact to that person. And those are the things that, again, why we joke, but it is a genuine, like, in every joke, there might be a little bit of truth, right? That podiatrists are the happiest doctors in the hospital. And it's these little moments where you make a big impact. And we do this all day long. So leaning into those, indulging in those moments of beauty and inspiration and awe, because it's a medical profession. There are moments that are not beauty and inspiration and awe, just like any other field. But we get a lot of those that really help kind of fill that cup, if you will. And we're starting to run a little short on time. So we're going to go with our last question that it kind of mirrors off that just a little bit. We had talked about it's not about acing every single exam. So how do you recharge your batteries? Because we do know from sports psychology that how you rest and recover is just as important as how you train. So let's start with Derrek, with the most wisdom of the group and experience. Derrek, how do you recharge your batteries?
Well, I am married, so I spend time with my wife. We go watch movies, spend time outside with the dog, that kind of thing, visit family. I play a lot of video games, I play a lot of video games in my downtime.
There you go.
Got some tactile input. It's not just watching a TV. You get to, work with your hands a little bit.
Yeah, engagement, spatial orientation. There's a couple of surgical skills that I think correlate very nicely with video games, but I might be biased. So, Disal, how about you? How do you recharge your battery?
Yeah, for me, on a personal level, I really like to go to gym. Simple thing as 30 to 40 minutes a day, like really takes my mind off just staying in my room and studying. But me and my friends, we've kind of started this tradition after like every big exam, we'll go out for ice cream. And so that's kind of our tradition. We'll have things like movie night Fridays, where we'll just join in our apartment and we'll just, airplay a movie to the TV and just do that. Right now we finished the Conjuring series from the very beginning to the end. So these are like the little moments that we really enjoy, going out to eat. Dr. Miller said, you can really find the best of any dish in New York, which is wonderful. Coming from like a relatively small town in Canada to New York, you can just have anything at the tip of your fingers. So I really do lean on my friends, and I really do appreciate them for being there for me.
Fantastic. All right, Megan, how do you recharge your batteries?
I definitely also very heavily lean on my friends that I've made at NYCPM. I think I wouldn't have made it this far without having friends to just de-stress with afterwards and go through all the pains and joys of everything about learning medicine and going through school together. We love to go to Butterfield Market in New York after a workshop and then go bring our lunch to the park and just sit on a bench and just talk and chat. So that's one of my favorite things to do. I love going to the parks in New York because I just think they're so beautiful. And I also like to paint also. So if I go by myself, I'll bring like a little mini watercolor set and I'll just paint things things that I find that are beautiful. So it's nice to just experience nature in a big urban city. And I also love to cook. So I like to sometimes I'll just pick a random page in a cookbook and try to see if I can do it justice and try new things that way. And also, of course, try the different cuisines that you can find in New York. The food's amazing. So I definitely take advantage of that as well.
Oh, I love that. And the more you eat out, the more you get inspired about what you're going to try to cook, right?
Exactly.
Yeah, I can mirror that. That was my coping mechanism with stress and residency was baking. And same thing, San Francisco. There was a lot of wonderful opportunities to indulge in the sampling side of inspiration. How about you, Dr. Miller? How do you recharge your batteries? We'll close out with you.
Ooh, so I do enjoy going to the gym, and I've become that 5 a.m. clubber. I'm up at 5 and I'm in the gym at 5 because I have a 7 and a 5-year-old that I now have become the light of my life, and they are amazing and they take every other second that I'm not at work. So it's the gym and then it's spending time with them and my wife. My wife is also a podiatrist. So we have very interesting conversations about life and medicine and patients. So it's often some unique things, but it's a great way to just relax and recharge. What about you, Dr. Richey?
Oh, man. Yep. I have a 7 and a 9-year-old. So I actually just came back from Girl Scout troop camping all weekend.
There you go.
So right now that's very much it. But baking and crafting kind of still aligns with my art. And then music, we do dance parties. And now we do karaoke because that little app on the Apple where it has like the little words, Oh man, that's like, I wish I had that as a kid. That would have helped so many wrong lyric karaoke's. But yeah. Well, thank you so much, all of you, for taking your time. Dr. Miller, thank you for coming to be my co-host. Megan, Disal, and Derrek, thank you so much. The future is in great hands with our amazing student population. And we're just really excited to see where your careers go. And to our audience, thank you so much for tuning in every week. And we're going to send you guys your Dean's Chat mug so you can start your day the Dean's Chat way. I got to get all of Dr. Jensen's mnemonics down. So please, look for that and coming in the mail. Hey, there we go. Dr. Miller has his. Fantastic. To our audience, please continue to follow us and leave a review. We'll continue to bring you leaders, including our student leaders in the profession. Until next time, everyone. Cheers.